through the legal relationship between a patient and a doctor, and also the medical liability a doctor can incur from a patient. It is no news that a doctor-patient relationship has to be formed before treatment can occur. So how can this relationship be formed? The relationship takes form from the point where the patient goes to meet the doctor and seeks treatment, and the doctor accepts to treat this patient. However, after a patient-doctor relationship has been formed, a doctor is bound to ensure that there is an informed consent of the supposed patient. That is, a patient must be told the purpose of the treatment, and he must also be given the information as to the alternative options available to the medical doctors. And lastly, he must be given information as to the foreseeable risks and side effects of the treatment option. However, a medical doctor can incur liability in 4 perspectives. First is from the crime or criminal perspective, from a tort perspective, from a contractual perspective, and through professional or ethical misconduct. What is necessary from the aforesaid is that the same set of facts could give rise to liability or to sue or to make doctor liable in any of these grounds. This then gives the patient or his lawyers grounds to choose when they want to sue. From the criminal perspective, just as a usual member of the society could be guilty of a crime, a medical doctor could also be liable when it comes to a crime. In fact, a medical doctor could be guilty of a crime when he engages in a practice that is prohibited, such as infanticide, which is the killing of newborns, abortion, or euthanasia, which is another name for mercy killing. Then he will be held liable if he engages in any of the above practices. Also, a doctor may be an accessory after the crime or accessory after the fact when he aids or abets a crime. For instance, where a medical doctor assists a person in carrying cocaine by way of surgery or implantation, or when doctors who treat a criminal who participated or who participates in armed robbery, and also where a doctor assists in the running of baby-making factories, then a doctor would be said to be liable in crime. The second perspective is from the tortious perspective. When a doctor does anything that breaches the duty of care he owes to his patient, then the doctor is liable in tort. For instance, where a woman suffers postpartum disorder or depression, and in which she has tendencies of being depressed or being suicidal after she gives birth, it is in the doctor's place, right, and duty to look after such woman before birth and even after birth. In an instance where after birth she is left alone and she commits suicide or does anything crazy to the baby, this doctor is the one that is going to be held liable for whatever harm is done to the woman or the baby. Now, in the third perspective, which is the contractual perspective, it has been argued that a doctor-patient relationship is both contractual and fiduciary, that is, a contract of good faith. When we say that there is a contractual relationship between a doctor and a patient, then it is assumed that the doctor is required to employ his best expertise dealing with the patient with high sense of care, skill, and knowledge, which a doctor would ordinarily employ. When he fails, he would be liable in contract by 3 ways. The first is where he fails to comply with his obligations to treat. Secondly, where he guarantees a particular result after treatment and he fails to meet up with that particular result. And lastly is where a physician carries out with a procedure different from the contractual or expected one, then is liable in contract. Professional misconduct is the last perspective at which a medical doctor could incur liability. This occurs where a medical doctor goes contrary to the provisions of the Medical and Dental Practitioners Act of 1988, or when a doctor does something contrary to the oath of service he or she has sworn. What is an instance of ethical misconduct? An instance of ethical misconduct is when a doctor sexually assaults his patient, kills the patient instead of treating the patient due to his own negligence. Then we can say this doctor is liable in ethical misconduct. These grounds are grounds at which your doctor could be sued or could incur liability if you feel like he or she has gone out of medical practice. This is official_Joel TV. Stay tuned and subscribe to watch more videos like this.